Hi, Dr. Kuldeep Wagh from Blossom Women Care, Law College Road. So today I am discussing about what treatment modalities a infertile patient has. I am considering both patients, one who is having PCOD and one patient in which I find no reason for her to conceive other than her anxiety to conceive. So let's talk about those 40% people who have this problem of anxiety to conceive. They don't find any factor to blame. So how do we go about it? If you do your hormonal results, everything would be normal in these 40% patients. And there's nothing to blame. So what does the doctor do? So the doctor, first of all, is the natural method of treatment that has the highest amount of success rate, about 60%. So the doctor gives tablets. These tablets would mature 1 or 2 follicles around day 12. Then a trigger is given of an injection which would rupture this follicle after 36 hours. And around that time, a follicle, an egg, stays alive for 1 to 2 days and the sperm stay alive for 4 days. So you have a gap of this 4 to 5 days to have an intercourse. So it's not necessary that you should have the intercourse exactly at the 36th hour. That is the first point. The second thing is we give 7 to 8 cycles of natural way of intercourse, and counseling is to be done in every cycle the patient comes to you. Secondly, after that fails, then we go a step ahead. We take the sperms of the husband and the sperms which swim up, we collect that and we put that inside the uterus. Means in a normal way it is kept in, the sperms are deposited in the vagina. Now we are depositing these sperms inside the uterus. That is called as intrauterine insemination, or IUI. We give another 4, 5, 6 cycles of IUI. If these fail, then the patient is subjected to IVF or test tube baby. There is a very wrong conception in the society. They think that if IVF is done, then the chances of its success is 100%. It is not so. The chances of natural way of having pregnancy is the maximum 60%, because the sperm is chosen by the destiny and even the egg is chosen by the destiny. Just think that at one time of intercourse 70 million sperm go into the vagina, but out of that only 1 sperm survives. So first is natural way, second is intrauterine insemination. It fails, then we go for the third, that is IVF. In this we take the eggs, we retrieve the eggs by sonography and we take the sperms out and then we match them and create embryos. And then 3 embryos are transplanted into the endometrial cavity around 14-15 days. That is called as IVF, test tube baby. But just the more we go on interfering, we find that the results go on decreasing. Natural intercourse has the result of 60%. If you do IUI, the results drop down to 40%. If you do IVF, the results drop down to 30%. So these are the modalities. But my advice would be not to rush in. Keep your mind free, which I am talking again and again, and try to be patient. Do not try to have this thought in mind that I want to have a baby anyhow. So if you go on rushing, you will find that once IVF fails, then you will be blank. What next? You will be left with no option. So be patient. I am going to talk in details about every procedure, and you have any questions, please be free to ask me. Thank you.